my name's Karen and I'm a hygienist at Summit Family Dental, and today I'm going to tell you what is entailed in preventative care. Or the first thing the hygienist should do is ask about their medical history. If you've had any type of joint replacement or heart problem, you should always talk to your cardiologist or orthopedic surgeon if you have to pre-medicate for a dental treatment. So the first thing I do is chart your gum health. This is called a Periodontal Probe. It goes in millimeter increments. So when you're cleaning your teeth or charting your gum health, you go along each surface of the tooth. Healthy gums measures 2 or 3 millimeters. Anything above 2 or 3 millimeters is considered inflammation. 4 millimeters is inflammation. Anything higher than 4 millimeters is considered periodontal problems starting to go towards the bone. When you have 5 to 6 millimeter pockets, you can't really get that bone back, so you really need to work on your gum health to maintain the oral hygiene of your gum health. First thing I always do is start with the lower front teeth. Get my glasses on. Here you tend to build up a little bit more tartar because you have salivary glands. So that tends to build up a little bit more tartar or a little bit more stain. If you breathe through your mouth or have allergy problems, you might tend to build up a little bit more here also. This instrument's called the sickle. I always start with it for these lower front teeth. It's a little bit easier to get the tartar in between the teeth, and it helps with the stain. My other go-to instrument is just a universal. So to start cleaning, each instrument is different for every type of tooth. This just helps, get the back teeth, and you go a little bit underneath the gums, and it gets the front teeth. For people with deeper pockets, I'll tend to get a little bit longer instruments. It'll help get those deep pockets to the depth of them. Sometimes if you haven't been in a long time, or you tend to build up lots of tartar, or you tend to have a little bit more stain, this is called an ultrasonic scaler, or some people call it a cavitron. Has different size tips. What you normally would do is you plug it in and you pump it with your foot. It makes a little bit of different noise. The tip vibrates, and then there's water that cools the tip off. This is really helpful for getting the stain off and lots of tartar. After that, I follow it through a polish. So you have different types of polish paste. Usually the coarse is for adults. It helps with the stain and it helps get the teeth nice and smooth. Kids kind of like the bubblegum flavor. That's not as coarse of a pumice for them, so they tend to like that. After that, I follow up with floss, and we talked in the last video how to floss your teeth. This at the very end of the appointment. This gets all the polish out and any debris that's left in there. So after that, I finish always with intraoral exam. So a cancer screening, I ask the patient to stick their tongue out, and I'm looking for different lumps and bumps, different coloring of the gums. I look all the way in the mouth, look in the back of the throat, and just to make sure there's nothing different. And that's a preventative care appointment at Summit Family Dental. Thank you so much.